Hello everyone, I'm Dr. Deepthi and welcome once again to another session of EQ series. So this is a video series where we discuss MCQs in short. It'll help you to approach the questions and we've been doing this every Wednesday, and this time we're going to do an obs and gynae question. So I decided to do a new pattern of AIMS MCQ which is called as extended matching questions, right? And the extended matching questions, they usually have a long sequence of options. For example, this is how the question starts. So please match the intervention A to G to the clinical situation given below, right? So we have more than 4 options. So it's a long list of options which is provided to us, and following which we are given clinical scenarios. So let's see what clinical scenario do we have today and how are we going to approach that clinical scenario and match it to the best intervention that needs to be done. So let's look at this. So this is a 37-year-old G3P2. She is 40 weeks pregnant. She has chronic hypertension, and she's been now induced with oxytocin. And what we see is that her cervix has been dilated 3 centimeters for past 4 hours. And I'm going to show you a fetal heart rate tracing for her. And based on this clinical background and correlating it with the fetal heart tracing that I'm going to show, we need to decide what is the best intervention from these options provided to us. So this is what is an extended matching question, right? So let's quickly look at the keywords in this question again. So she is a woman who's 40 weeks, gestational hypertension, she's been induced with oxytocin, and she is 3 centimeters. So the first thing that strikes us here is that she is still in the latent phase of labor, because as per the newer criteria for active phase of labor is that it is active beyond or equal to 6 centimeters. So this woman is still in the latent phase of labor. It's been 4 hours, so which is not something to worry about, right? And based on this, let's see the fetal heart tracing or the CTG, cardiotocography tracing, that has been provided to us. So let's look at this cardiotocography tracing. So this is a 10-minute tracing for the patient, and the bottom graph, as you can see, shows us the uterine contractions, whereas the top graph shows you the fetal heart rate, right? And in this graph, if you see, the fetal heart rate has been around 120, but do you note that it is showing you dips? Yes, so this fetal heart rate tracing is showing us dips. Now, once you understand that it is showing us decelerations, we need to find out what kind of deceleration is it, right? So number one, is it a quick fall and a quick pickup, or a gradual fall and a gradual pickup? So if you realize, it's a slow fall in the fetal heart rate from 120, and then it slowly picks up and goes back to 120 again, right? So if it is a slow fall and a slow pickup, it cannot be variable decelerations. So these could be either early or they could be late deceleration. So now we need to find out what decelerations are these. Are these early or late? So if you realize, the dip in the fetal heart rate is actually starting at the peak of a contraction, and it persists even after the contraction, right? So a slow fall and a slow pickup which is persisting after the contraction and which has a delay in the onset, which means it is not starting with the contraction, rather it is starting when the contraction is strongest, is the classic what deceleration? Yes, you're right. This is going to be a late deceleration. Now, so this is a patient who is still in the latent phase of labor and is showing late decelerations. And 1, 2, 3, 4, she's showing, so this 10-minute graph is actually showing us almost 4 late decelerations. And looking at late decelerations, you will think that, okay, if it is late deceleration, it is a marker of uteroplacental insufficiency. And if it is uteroplacental insufficiency, you would think that from the options provided to us, the answer would be cesarean section, right? Or a cesarean delivery. But now let's go back to the graph again. Let's go to the bottom of the graph, which is showing us uterine contractions. Can you tell me how many uterine contractions can you see? So if you have counted it right, there are 7 contractions. 7 contractions in a span of 10 minutes. Does it ring a bell to you? What is this? This is hyperstimulation, right? So it is a uterus which has been hyperstimulated because we were giving her oxytocin. So probably oxytocin has not been given well monitored. So you are seeing more than 5 contractions in a span of 10 minutes, which is how, along with dip in the fetal heart rate, which is how you describe hyperstimulation. So if you talk about only more than 5 contractions in 10 minutes, then that is described as tachysystole, right? But when this tachysystole is associated with a dip in the fetal heart rate, which is what you see in this tracing, then it is called as a hyperstimulation. So this is an NST graph or a CTG graph showing us hyperstimulation. And therefore, what do you think you should do? So one of the first thing that we should do is start IV fluids, put her on the left lateral position, stop oxytocin. Let's see, do we have these in our options? Let's see quickly. So number 1, so we don't have IV fluids, we do not have stop oxytocin, we do not have put her in the left lateral position, give her oxygen by mask. So what do you think is the appropriate answer here? Look at option G, terbutaline. What is it? It is a tocolytic agent, and this is what you need to do here. So if stopping oxytocin doesn't reduce the number of contractions, the next thing is give her tocolysis. So the best answer here is going to be option G, right? So this patient should be given terbutaline, which is a tocolytic agent, which will reduce the contractions and the fetal heart rate will recover, right? So the management of this question, although it did show us what? Late decelerations, but when you combine the two things, you see that it is hyperstimulation, and which is obvious because this woman has been induced. So we have a reason why there is hyperstimulation, and therefore the appropriate intervention for this woman would be injection terbutaline, right? So that's how you approach clinical MCQs. You should try and pick up keywords. So here the keyword was that the woman has been induced. She's still in the latent phase of labor. Club it with the visual provided to you, which is a late deceleration showing us uteroplacental insufficiency. But the cause of this was hyperstimulation of the uterus, which is more than 5 contractions in 10 minutes, causing dip in the fetal heart rate. And the first interventions are stopping oxytocin, giving IV fluids, give her oxygen by mask, put her in the left lateral position. But amongst the options provided to us, the absolute management here would be injection terbutaline, which is a tocolytic agent, right? So I hope you understand and get a good overview of what an extended matching question is. It simply creates more confusion because you have more options to select from, right? So see the question as a whole and then attempt it, right? And we would be coming up with more such new pattern questions in the coming time, and give you a good overview on how things are to be done. And if you really like us or the discussions that we have done so far, and if you have more ideas and topics that you want us to make such EQs or small question discussions, do let us know. Please follow us on the DAMS Delhi YouTube channel and Facebook, and please give us your feedbacks. Thank you so much. Best wishes.